Hello everybody, I'm Dr. Rehan Sabir. I'm a general surgeon at Maven Medical Center, which is a daycare surgical facility in Hyderabad city. Today we are going to talk about a procedure called as circumcision, which is very commonly done across the country, everywhere in the world in fact. The circumcisions it's a procedure which is done both in the children as well as in adults group. We'll talk about the circumcision in the adults and then we'll go to the children. Circumcision, what is a circumcision? The people ask what exactly does it mean? Circumcision is nothing but there is a extra skin at the penis, at the vital area, the penis. It's a foreskin that we call it, and this foreskin has to be removed surgically with the help of a surgery and different procedures. There are different approaches to remove that skin, and once we remove that skin, that procedure is called as a circumcision. What is the need of the circumcision? The next question arises, what is the need of the question? What are the indications? In other words, why do we need a circumcision? See, usually in adult group, that's what I want to talk to you about more about the adults. Because in adult group, what we find is the very common cause of circumcision is the penis, the penile area, and the skin over it, but we call it as a foreskin, that gets stuck at the tip of the penis. And it is a condition we call it as a phymosis. So because of the unhygienic condition, because of the individual who doesn't take care of the cleaning part after urination and all, or after the sexual act, the layer of the foreskin gets stuck to the glands of the penis, and it cannot be pulled on proximally on the upper side, and the patient will feel as if the skin has been stuck, and when the patient urinates, the urine gets ballooned up in the skin, and this causes pain, this causes infection. So the patients will come with stucking of the skin at the tip of the penis. This condition is called as a phymosis, and there is a very associated condition called as paraphymosis, which is also very commonly seen in the adults. In this condition, what happens, the skin once been pulled up, it doesn't go back, it gets stuck, and there is a constriction ring around the penis, and this is more painful than the phymosis. So the skin gets stuck in the circumferential ring-like manner, and when the skin gets stuck, the skin above that ring, it starts getting swelled up. It forms an edema and becomes very painful. When this patient comes to us, we find a big ring around the penis, a lot of fluid inside. What we do is, initially, just to make them symptomatically relieved, we puncture that part of the skin, and a lot of fluid comes out. So when the fluid comes out, it gets collapsed, and then it is very easy for us to bring it back to its normal position. But in these type of patients, we advise them to get the circumcision procedure done as early as possible, because there are chances of recurring this condition again. And to avoid that, the circumcision is the only method by which they can get rid of this problem permanently. There are other conditions where the patient will require the circumcision. Secondly is, as I told you, it's very common infection to see at the tip of the penis, and we call it as the phymosis and the paraphymosis. Likewise, there is the infection of the foreskin. So because of the infection of the foreskin, the skin will become red and become shined up and stretched away. But just by looking at the skin, we can tell that the foreskin of this patient has been inflamed. So we go ahead, we ask the patient to get that particular skin get rid of by the procedure of circumcision. And the other methods, the other indications are those people who have been diagnosed of cancer of the penis, and in those conditions, they need to give radiotherapy of the tip of the penis, exactly where the cancer is situated. So in these type of patients, the foreskin needs to be removed so that the radiotherapist get a clear view where to give the radiotherapy. So these are also one of the indications where we advise the patient to undergo a proper circumcision. Now, the method of doing a circumcision is, there are multiple approaches, and multiple new devices have come into the market where the circumcision becomes more easy. But the Association of Pediatric Surgery in our country, they recommend the open method, which we call as a sleeve method. It is an open method where the patient is being circumcised under the effect of a cover of anesthesia. Spinal anesthesia is being given to the patient in the operation theatre setting, and we cut the skin at the two different parts circumferentially with a distance of about 3 centimeters. So the 3 centimeter patch of the foreskin is being taken out, and the proximal and the distal part of the skin has been sutured by the absorbable sutures. There is no need to remove them. And the patient has to just keep it clean and put some ointment, antibiotics for a period of 7 days, and the wound heals very nicely. This is a very common method and a very safe method to undergo a circumcision. Apart from that, there are certain clamps which has come from different countries, and they have come with a clamp, and they have come with the staplers, ZSR staplers. There are so many other devices which have come. The only thing is that they are also equally the good. They give the good results, but the only thing is that they are blind procedures. We do not see the glands of the penis while we do those circumcisions, so there are chances of injury to the glands. Once it gets injured, bleeds or it's very difficult to control the bleeding there. So the open method of the circumcision is the safest, where everything has been done under direct vision. Now coming to the pediatric age group, very commonly the circumcision is done in the pediatric, in the infant, usually in the Muslims as well as in the Jews. There's a religious obligations that they do. And apart from this, we see pediatric age group coming with a problem of phymosis, which I have already talked about in the adults. And there is a ballooning of the skin is there when the baby urinates, just because the skin has been stuck at the tip of the penis. So these are also the same condition goes with the pediatric age group, that we have to do a circumcision so that the baby gets rid of it. And one more advantages of doing a circumcision is that when this baby grows up, or the individuals who have undergone a circumcision, the chances of transfer of the infection to the spouse, to the wife, becomes very less. Because those individual has been seen, those who have not circumcised, there are chances of getting the carcinoma of the penis. And if these individuals, they have their precursors and pre-malignant condition, and when they have sexual act with their wife, there are chances of the infection to get transferred to the wives. So in this way, we can prevent the many individuals from getting these type of infections and the cancerous lesions. So, and it's very safe. We have been doing circumcisions since a long time at Maven Medical Center. We usually do it with the open method, and if the patient prefers, we also can do it with the staplers, which is a new device which has come. And it's a very safe procedure. It can be done in approximately in half an hour, and the patient can be discharged on the same day. So if you have anybody among your friend circles who requires a circumcision procedure, or who have been suffering from this problem since a long time, please come and please visit us, visit our consultants, and get the best help done from us. Thank you so much.